Hello, I'm Dr. Satish. I'm with the medical SHOs.
I'm Isobel tissue viability nurse.
Tissue viability nurse. Right, okay. Nice meeting you. I'm going to just have a quick chat with you regarding leg ulcers. How many pressure sores do you come across in a month, and what grade are they?
Well, I tend to see the really deep pressure sores rather than the ones that are, just superficial and broken skin. And I would say maybe about 5 a month.
Okay. Who comprise your team?
Myself. And we do have link nurses. We have one from each ward and each area of the community.
So they refer to you if they have a problem, and then you handle it?
Yes.
Who do you refer to if you have any problem, like if that is not healing? Or?
Well, really anybody, dietitians, GPs, consultants, anybody that...
Surgeons?
Yes,
surgeons.
yes.
Right, okay. A few questions about educating ourselves. What is the commonest cause of pressure sores in your experience? What are the commonest causes rather?
Probably tissue ischemia and shearing and friction and moisture.
Where does it start? Does it start in the hospital or transport or transfer or whatever?
It can start anywhere. That's the thing. And it's usually patients that are pretty debilitated who develop pressure sores. But having said that, even young, healthy women in maternity can develop pressure sores if they're immobile due to anaesthesia, not moving. The pressure causes ischemic.
So we should be careful on both sides, but more on the debilitated patients. But even then, we should not miss the younger ones.
Even young babies, you can get pressure sores on the head, if they're not being turned frequently enough.
What percentage of them do you think are preventable? And I think it should be a good proportion, isn't it?
I think probably most of them can be preventable, but if you've got a terminally ill patient, the chances are that they're not preventable.
They may not be able to prevent it.
Their systems are shutting down, and there's really nothing you can do apart from turning them.
But most of them are.
Yes.
Most of them. Right. Are you involved in educating the staff to prevent pressure sores?
Yes.
And how do you do it?
Well, we run study days, and also as I'm going around seeing patients, try and get the nurses and the wards involved. I think we're probably needing to do a wee bit of work with the untrained staff, because they do a lot of the caring, and maybe need to start there too. Making sure that incontinent patients are, that people know what they're doing with these patients.
I've seen that we have introduced the pressure mattresses and several things in the recent years, isn't it? Do you think they have made a huge change in the prevention of pressure sores?
Undoubtedly, but at the same time, these pressure mattresses have the same pressure relieving capacity all the way along, and sometimes the heel area of patients is quite vulnerable, and these beds are quite hard on that area. So sometimes it's advisable to use pressure relieving boots as well.
Right. That's very helpful. Thank you very much. Okay. And thank you very much, Anna, who's the cameraman here.